Good evening. Good evening. I'm Patrick Verone, President of the Writers Guild of America West. Thank you for being here. I, for one, am not supposed to be. If anyone asks, I'm at home writing a script about iPhones in the 31st century. We are so pleased at the Writers Guild West tonight to partner with Hollywood Health and Society on this event, the first panel discussion of the HH&S Global Health Initiative. There is a growing trend in entertainment to look not only within but outside of U.S. borders, and global health issues make for truly compelling storylines. In fact, the script I'm working on about iPhones in the 31st century actually has a health component, because in the 31st century, iPhones are actually phones implanted in your eye, and you Twitter kind of like this, and there are these killer apps that are actually killer apps. Since that joke worked, I'm going to put it in. Tonight we have an extraordinary panel who will speak to you from the global perspective. To introduce our keynote speaker, I'd like to present Sandra de Castro Buffington, Director of Hollywood Health and Society. Sandra.
Thank you, Patrick. Good evening. I am so glad to welcome you to this event. We have a terrific group of writers, producers, Hollywood Health and Society board members, and public health experts. Hollywood Health and Society works with television writers to help them get accurate medical information from experts for their scripts. And as part of our Global Health Initiative, which supports writers in addressing global health, I am delighted to introduce our keynote speaker, Dr. Tachi Yamada. Dr. Yamada is president of the Global Health Program at the Bill and Melinda Gates Foundation. In this position, Dr. Yamada leads the foundation's efforts to help develop and deliver low-cost, life-saving health tools for the developing world. He oversees the grant-making of the Global Health Program, focusing on 4 major areas: discovery, development, delivery, and advocacy. In 2008 alone, Dr. Yamada's program granted $1.8 billion toward global health programs. Dr. Yamada has worked in many sectors of health, the private sector, clinical medicine, and academia. Before joining the Gates Foundation, Dr. Yamada was a chairman of research and development at GlaxoSmithKline. He also chaired the Department of Internal Medicine at University of Michigan Medical School and was a physician-in-chief at the University of Michigan Medical Center. Please welcome Dr. Tachi Yamada.
Thank you very much, Sandra. I'm delighted to be here. Of course, very proud that we support Hollywood Health and Society. I'm here to talk about global health, and maybe we should start with a definition here. What is global health? At one level, it's about health, and health, like everything else, has become globalized. It used to be very local. In fact, in many parts of this world, it's still very local. But things change very rapidly with the speed with which people can get from one part of the world to the other, and how quickly the internet allows communication to take place. So when we think about global health, we think about things like HIV. HIV starts in one part of the world, has an incredible effect on society in the United States. Or let's take the example of Andrew Speaker. Anyone remember Andrew Speaker? Young lawyer who had drug-resistant TB, got on an airplane, went on a honeymoon, and then it was like, you know, O.J. Simpson being followed by a television camera. They followed Andrew Speaker until he was eventually almost incarcerated in the U.S. And then they found out he didn't really have the highly drug-resistant TB. There's the issue of SARS, and how quickly SARS went from being a problem in remote China somewhere to almost destroying the Singapore economy, and had a devastating effect on the Canadian economy at one point. It also taught Canada a lesson which we haven't had in the U.S. yet, that they have a broken public health system and it led Canada to try to rebuild it. Because we escaped SARS, we're now facing another global health problem, H1N1 influenza, and we don't have a public health system to deal with it. And I'll talk more about that in a minute. But there is really much more than just the globalization of health. And I'd like to start with a story. I'm going to tell stories tonight because I understand this is how you tell stories. So I think back to the time I was actually pretty happy at GlaxoSmithKline, and we had many programs involved in global health. And at one time, I came to the Gates Foundation to talk about the programs, and that's when I was approached about whether I'd run the global health program at the Gates Foundation. And I wasn't sure, but I interviewed with Bill and Melinda. And when I was talking to Melinda about the problem of global health, something happened to me that really surprised me. And that was that a memory came back that I had suppressed for 30 years. I was a resident in an intern in a hospital in Virginia, and I remember seeing a 16-year-old African-American mother come in with a child, and she was gripping the child so tightly that it took us about 10 minutes to get her to let go of this child. And when she let go of the child and we could examine the child was dead. Now, it was a devastating experience for me. As an intern, of course, you see people dying, but this somehow touched me so much that I really suppressed this memory. I didn't think about it. I went home and cried about it that night, but I didn't think about it for 30 years. But when I was speaking to Melinda, it came back, suddenly roaring back. And it was because I recognized that then about 10 million, now closer to 9 million children under 5 die each year for treatable or preventable reasons. And it's hard to understand what that means until you can actually crystallize that into the death of one child and the impact of that one child's death on you as a person. And then you think, 9 million, it's just unbelievable, unbelievable. And so that is the difference between global health being just health, globalized, to what is really a moral tragedy. There's great inequality in health. Life expectancy in sub-Saharan Africa is under 50, and in most parts of the world it's approaching 80. Many, many people are kept from living productive, meaningful lives because of this inequality. And this probably more than anything else contributes to the instability that we face every day in the world. So the Bill and Melinda Gates Foundation, whom I work for now, is about this problem, about the fundamental belief that all lives have equal value. And there are many different things that we could do in this area, but we have this bias, which is that technology-based health solutions are the most economical way to get to people all over the world. We focus on infectious diseases, maternal and newborn child health, nutrition, primary areas of interest. And where technology-based health solutions exist, we try to make them widely available. So we're one of the largest supporters of the Global Fund to fight AIDS, TB, and malaria. They distribute antiretroviral treatments and TB medicines and anti-malarials. We're also one of the initiators and the largest contributor to the Global Alliance for Vaccines and Immunizations, trying to make vaccines available to as many people as possible. But where the solutions don't exist, we discover, develop, and deliver new solutions. Now, the question you might ask is, okay, this is a big problem out there. Does America care? Does it really make a difference to our lives? Well, you'd be surprised. The Kaiser Family Foundation ran a poll not too long ago, that showed that 2/3 of Americans favor maintenance of the amount of development assistance we provide for health in the developing world, or increasing it. 2/3 believe we should, in this difficult economic time, maintain our commitment or increase it to diseases of the developing world. That's really astonishing. But when you actually think about what people do, they'll pull money out of their pockets. There are two episodes, I hate to say it, but I don't watch much television. But we sponsored 2 episodes of American Idol. And these 2 episodes were focused on issues of health and economic deprivation. And these 2 episodes, 2 nights, raised $159 million. Americans pulling money out of their pockets, doing something about it. Now, another unbelievable example is this fight against polio. We don't have this problem of polio. Polio has been beaten back by technology, by a vaccine. And now polio is left in it's really endemic in just 4 countries in the world. There's Nigeria, India, Pakistan, and Afghanistan. But it's really India and Nigeria where we really have to fight this battle. We're down to the last part of it, and the last part's more expensive than all the first part of it put together. And for this, we have a partner, Rotary International. In a challenge grant we've provided to them, Rotary International, a group of citizens, people like you all over the world, are putting up $200 million for this campaign. Did you know that the Lutherans and the United Methodists each have put up $100 million to fight malaria? So, yes, America cares. Absolutely, America cares. People, when they hear the stories, understand what has to be done, are willing to pull money out of their pockets to address this problem. Now, we're a pretty large foundation. You heard last year we gave out $1.8 billion worth of development money, if you will. But we're actually a relatively small player in this field, in the sense that there's about $25 billion going for development assistance. Now, mostly it's governments like the United States or the Department for International Development in the UK or other development assistance agencies. But even $25 million is not enough. The World Bank estimates that in order to really address these problems of the developing world, in order to reach the Millennium Development Goals that were set up at the turn of the millennium, we need about $75 million a year. So this is why I'm here, because we can't reach everybody. You can. You can tell the stories that will help to commit people to ideas which the government will listen to and the government will contribute to. Now you're really the master storyteller, so I really hesitate to tell you stories because I'm not all that good at it. But let me just tell you a few that might set the stage, and then I'm happy to answer questions if you have any. So how did I get here? You know, I had a very long academic career doing medical research, seeing patients, teaching. I enjoyed that. At one point, the idea of being able to make medicines that would have impact on people's lives all over the world was really appealing to me, enticing. So I joined a pharmaceutical company. And what happened to me